Welcome to Module 2 in the Professionalism series. This series includes 5 modules: Professional Competence and Ethics, Personal Competence, Reflection and Ethics, Interpersonal Communication, Professional and Personal Image, and Social Awareness. In Module 2, we will be discussing interpersonal communication. The goal of this video is to introduce the topic as it relates to the field of communication sciences and disorders, specifically the disciplines of speech-language pathology and audiology. Interpersonal communication involves any conversing or exchanging of information that one does with another individual, such as a supervisor, colleague, or client, through any channel or modality, including verbal, written, and nonverbal methods. Verbal communication involves vocal conversation that can take place during face-to-face interactions, through phone calls, or even video conferences. Written communication can be emails, text messages, patient documentation, and so on. Lastly, nonverbal communication involves gestures, facial expressions, and other ways that your body movements convey information. Before exploring professional aspects of each channel or modality, it is important to address the pillars of interpersonal communication that are universal. Several key factors of successful interpersonal communication are respectful, appropriate, and honest communication. By considering the opinions and cultural differences of others and remaining truthful in your exchanges, you are demonstrating quality interpersonal skills. You can be further successful by having an awareness of your audience. This will allow you to craft your conversation in a way that is beneficial to all parties involved. For example, if you are discussing a patient's ability to swallow whole foods to a dietitian, you may have to incorporate more layman's terms than you would if you were collaborating with another speech-language pathologist. Knowing your audience will help avoid any unintentional miscommunications and keep your message clear and concise. Lastly, responsiveness is crucial to successful interpersonal communications. This includes responding in a timely manner regardless of communication modality, fully addressing any questions or concerns, and never leaving anything unanswered. This responsiveness will show that you are an attentive, efficient, and collaborative student, clinician, and professional. Now, let's explore professionalism specifically related to verbal communication. When verbally conversing with others, it is important to be aware of your vocal tone and register. For example, if you are discussing sensitive information to a client regarding their prognosis, you want to sound supportive and empathetic. This will facilitate a comfortable environment for the client where a conversation can occur around this sensitive topic. Further, be cautious towards the use of sarcasm, as sarcasm can often be offensive or misinterpreted. For example, you would not want to walk up to your supervisor and say, "Wow, that patient really gave their best effort today," in a sarcastic tone, as this may portray false information or sound harsh and insensitive. Additionally, be aware that client education and counseling will primarily be done verbally, so it is important to be thorough and prepared to provide resources and advice to any client and/or family. Regarding written communication, when emailing someone, make sure to use professional salutations such as "Hello, Dr. Smith," and always include your signature and credentials. In addition, make sure to use clear and direct subject lines. This will allow the reader to quickly identify the main topic being addressed. Text messages are a common form of written communication, however, should be used only when appropriate and agreed upon by both parties. For example, if a parent has expressed their preference for you to text them, it would be appropriate to message them if a therapy session gets canceled or needs to be rescheduled. Although text messages allow you to be brief, it is important to remain professional in the body of the writing. Avoid slang terms, spell words out, and only use nicknames if requested. For example, typing "We look forward to seeing you today at 4 p.m." would be more appropriate than typing "See you later today." Lastly, regardless of the type of written communication, always proofread your writing to avoid typos, spelling errors, and other unintentional mistakes. Beyond verbal and written communication, it is important to remember that you are always communicating with others nonverbally. This nonverbal communication is carried out through your body language, facial expressions, eye contact, and overall behavior. For example, if someone is conversing with you and you are looking around or attempting to multitask, it may appear as though you are not listening. Contrary, if you maintain appropriate eye contact, it'll show the speaker that they have your focus. Additionally, if you walk around with your arms crossed or sit in a slouched position, this may be interpreted as disinterest. Exercising an upright posture, an attentive facial expression, and maintaining appropriate eye contact shows the listener that you're receptive to the information that is being presented. This will allow others to feel as though they are being heard and respected, which is a primary goal of nonverbal interpersonal communication. One caution with nonverbal communication is to consider the variability in eye contact, turn taking, and body language, which may be considered acceptable and practiced among cultures. It is important to be knowledgeable, respectful, sensitive, and aware of your audience. This concludes our module on interpersonal communication. Overall, interpersonal communication plays a vital role in the field of communication sciences and disorders. Remembering the pillars and specific aspects of each category will enhance your professional demeanor as a future clinician. Thanks for listening. The next module will present professional dress. We'll see you there.